guys, welcome back to my YouTube channel InfoBro. This is me, your InfoBro. So today's topic is paracetamol poisoning. So you all know what is paracetamol. It's a drug, of course. So what is paracetamol poisoning? So let's dive into the topic. It is a common paracetamol poisoning is common because of its wide availability. Eh? Wide availability as over-the-counter drug. So it is common due to its wide availability as the over-the-counter drug. So the maximum recommended daily dosage of the paracetamol is 4 gram. So maximum dose of a paracetamol that can be consumed in an adult is 4 gram in a day. So the toxicity is likely to occur if we consume the amount doses greater than 250 milligram per kg per day. So toxicity is likely to occur at this rate. So mechanism of toxicity. So let's know what is the mechanism of the toxicity. So usually the paracetamol is metabolized by the conjugation. So it is metabolized by the conjugation in the liver to non-toxic compounds. So what is usually happening? So the paracetamol is metabolized by the conjugation in the liver to non-toxic compound, but in acute overdose. So what's happening in the acute overdose? In acute overdose, the metabolism by the conjugation becomes saturated. So the metabolism becomes saturated in the acute overdose, and thus the excess paracetamol will be there. This excess paracetamol is oxidatively metabolized by the CYP enzyme. So the excess one is metabolized by the CYP enzyme. And what is produced by this enzyme? It produces the hepatotoxic metabolite. What all hepatotoxic metabolite like N-acetyl parabenzoquinone imine, and this, what is it? Acetyl parabenzoquinone imine. N-acetyl parabenzoquinone imine. You have to remember this. So NAPQI, and this leads to the hepatic injury. Now for the clinical feature. What is the clinical feature? Initial complaints are the nausea, vomiting, diaphoresis, pallor, lethargy, and malaise. Nausea, vomiting, pallor, lethargy, and malaise. And the liver damage can occur. The liver damage, yeah, it's hepatotoxic, of course. Liver damage will be there. It develops 1 to 3 days after the injection. And the next is the jaundice, hypo, jaundice and hyperammonemia. The next features are the jaundice and hyperammonemia. Sorry for that. And then the enzyme AST and ALT will be increased. And the next is the renal failure and acute pancreatitis. Rarely the renal failure and acute pancreatitis is occurring. Now for the confirmation. For the confirmation of the diagnosis, we are using the measurement of the serum paracetamol level for the confirmation of the poisoning. Now for the management. So what all need to be done for the management? So for the management, we have to use the gastric lavage, and the second one is the activated charcoal. So what is it? First we have to use the gastric lavage and then use the activated charcoal. Now for the antidote. What is the antidote? So antidote is N-acetylcysteine, or we can say it as NAC. So N-acetylcysteine is the antidote given, and it is given within 10 hours So it is the antidote and it is given within 10 hours of the overdose. Now for the next one, that is the methionine. The methionine is 12 gram given orally. So methionine is given 12 gram orally. And the last one is the liver transplantation. It is to be done with patients who develop acute liver failure. So liver transplantation is the last one, and you can take a screenshot here. And thank you.